physician, healthcare workers, patients, friends, general population out there. A big namaste. So this is the time for namaste, neither a hug nor a handshake. I'm Dr. Manoj Chawla, Diabetologist in the city of Mumbai, and I am speaking a bit about COVID-19 and diabetes mellitus. I'm a diabetologist and not an infectious disease specialist, but I'm extremely concerned about this pandemic and the disease currently affecting millions of people with diabetes all over the world. We need to remember that persons with diabetes are not more prone to get infected with this virus. However, once infected with the COVID-19 virus, their chance of developing complications or poor outcomes is much worse than the general population. So this, of course, is because persons with diabetes may have decreased immunity, especially if they have not maintained good glucose or good metabolic control, have been running high on their sugars, their HbA1c, or other comorbid conditions like poor control of blood pressure and cholesterol. And hence, people with diabetes out there are more prone to developing higher complications in case they get infected with the COVID-19 virus. So COVID-19 is of the coronavirus family, which has existed for a long time and was always considered to be inconsequential, a pathogen causing the common cold as we understand. However, in the recent decades, there have been certain variants of the human coronavirus which have spread much deadlier diseases. The SARS, severe acute respiratory syndrome coronavirus, or the Middle Eastern respiratory syndrome, the MERS coronavirus, which were there in the previous decades. And now this disease, which started in Wuhan, China, in the latter part of 2019, which is now spreading across the globe and has been given the name COVID-19 by the WHO in 2020. Now, my message to persons with diabetes is, well, you have to observe the same precautions to avoid getting infected. And the only known way of preventing this disease today is isolation, social distancing, and self-quarantine. Avoid moving out of the home unless absolutely essential. Avoid contact with any possible contact with anybody known to have traveled or have had this disease. And that is going to be the only way one can avoid the spread of disease. Also important to remember that those of you who may have been struggling with keeping the diabetes under good control, this is the time to step on that and get your diabetes under control. My message and appeal to fellow physicians across is be available to your patients with diabetes. You can be available to them via phone, via video conferencing, online consultation, or see them physically as possible. But be available because this is the time that patients with diabetes need you the most. They're anxious. They're not able to do their physical activity. The stress, all of this is rising their sugars. And for some of them who had not maintained or thought much about their blood sugars are now extremely worried as they understand that they are more prone to developing complications of this virus once infected. So please be available for them. Please treat them with whatever available means to try and control their blood sugars and other comorbid conditions better. We know that there is no treatment which is validated and approved for usage. There have been reports of use of some antiretroviral or antiviral agents being used. And of course, the recommendation by the ICMR for the use of hydroxychloroquine and chloroquine as possible agents for use in people who have developed this infection or of those who've directly been in contact with COVID-19 positive patients or healthcare workers working in similar facilities. There are some concerns raised about the safety of hydroxychloroquine. As a diabetologist who has been using hydroxychloroquine as an add-on therapy for patients with diabetes, I can say for sure that there are no safety concerns seen in most or majority of the patients. In fact, we had a 1-year data of more than 200 patients treated with hydroxychloroquine for diabetes, which was an approved abstract to be presented at the ADA in June, Chicago this year. And this entire experience spoke about the efficacy of hydroxychloroquine as an add-on drug in patients with diabetes without any major safety concern. So it's a drug, but which has to be used only in as per the approval and the recommendations of the ICMR. For patients with diabetes, it's already approved in India as an add-on drug, and you can give the benefit of this drug to your patients with diabetes. So again, an appeal to my physician friends, please be available for your patients with diabetes. This is the time they need you the most. And for the other healthcare workers and the general population out there, please stay safe, take care of yourself and your family. We all must be united and have similar approach in fighting this virus. And remember that we will prevail over the disease. This reminds me of a quote which goes as saying that the goal of every physician today must be to prevent the disease and not treat it. Bye-bye.